Do you have somebody hidden down here? Do you have somebody hidden down here? Sounds pretty good.
When I was a kid, a nurse had this very starched white uniform.
White stockings.
White stockings,
and
white shoes.
And a cap.
And some of those caps just were, you know, very big, very fashionable. I can't help but notice you talked earlier about your frog scrubs, and this is not quite. You're not wearing any hat.
No.
You're not wearing any white. Tell me about how the uniform evolved. You wore the whites?
I did. When I first started, it was a big thing when we went from dresses and we went to pants, and that was in the service. But it was all white, and that was an expected part of the uniform. But we wore a cap because that was considered our cover, which was part of the uniform. As time progressed, then we went to individual choices in uniform.
But what was that transition? Was that nurses that said, I don't want to wear the man's clothing anymore and I want to make my own choice?
I think you tried to become closer to the patient, and if you were a pediatric nurse, you wanted something that made the pediatric patient feel more comfortable with you, and they don't really relate to starched white uniforms. They relate
Children don't.
They relate to color. Color is warm. It's more inviting.
This makes so much sense.
Well, it does to us.
Well, why didn't that make sense in 1946?
Well, there was a lot of different things going on in there. The doctors were still the gods in 1946.
Oh, yeah.
And you were
so they thought.
You were expected to step back, or I used to have one doctor who would stand behind me, you know, I was seated, and I was expected to get up and give him my seat, no matter what I was doing.
Ooh.
So things have changed. We're much more a partnership now in taking care of the patient.